think that other sign-on is right now, so.
Are we open now?
Yes, if you want to get started, that's fine.
Okay. At this time, I'll call this meeting of the South Central Pennsylvania Genealogical Society to order. I'm Richard Conkle. I'm the president of the society. And usually we meet at the History Center, which we've been doing with a very small group here since the pandemic. We're not having a meeting at all. So today, I think, is our first venture into having a meeting by Zoom. So I'm obviously not at the History Center. Nicole Smith, who's the librarian and archivist, looks like she's standing on Market Street, but I think she's in the comfort of her own home. And we're very happy to have all of you join us. I would ask that any board members who are attending stay behind briefly after the presentation so that we can kind of coordinate a board meeting, which we are in need of having here soon. So I believe Nicole has some announcements from the York County History Center, so she wants to do those at this time.
Hello, good to see everyone. Well, thank you all for coming. I can't see you, but I'm glad you are all here. Just a couple of brief announcements. First, if you have any questions during the presentation today, please type them in the chat feature. We'll be checking questions on Zoom and on Facebook, and we can address your questions after Pam's presentation. The History Center is planning to open to the public on April 1st, and admission and programs will be by reservation. In the meantime, we have a number of great digital programs to offer. If you visit our website, yorkhistorycenter.org, just a couple coming up. Next Saturday, Scott Mingus will be speaking about the Cumberland Valley Railroad in the Civil War. The Civil War Roundtable has a program with Peter Miele, the director of the Seminary Ridge Museum, who'll be speaking about the Underground Railroad. And on February 27th, we have a program with Nisi DeShields, who will be speaking about researching African-American genealogy. Thank you very much.
Thank you. So we're not going to have treasurer's reports or readings of the minutes from the last meeting. And Jonathan has only text capability here. So I'm sort of doing a little bit of his position, and then I'll introduce today's speaker. But before I do that, I do wish to tell you about our upcoming programs that you will hopefully attend as well. So 1 month from today, March the 7th, also a Zoom meeting at this point in time, will be the Pennsylvania State Archives Move into the Future. And our speaker for that will be David Carmichael, who is the State Archivist of Pennsylvania. So we're looking forward to that very much. April 11th, which I believe is the second, not the first Sunday, because I believe the first Sunday of April is Easter Sunday. So we will not be meeting on Easter Sunday. But April the 11th is a program entitled Mother Cumberland, which is researching with Cumberland County records, which will be presented by Kara Curtis of the Cumberland County Historical Society. And at this point in time, it's still not 100% established, but we're hoping we're able to do on May the 2nd, a tour of Muddy Creek Forks. The Maryland and Pennsylvania Railroad Preservation Society will be giving us that tour, and I believe it involves a brief train ride and some other things. So we're looking forward to that and hope that goes off. And at this point for June the 13th, which again is not the first Sunday, but actually the second, we have a Henry James Young Award program scheduled currently for that time slot. Okay, so our program today is History and Introduction of the York County Coroner's Office. In this program, we'll learn about the history of this York County Row Office, the duties and responsibilities of the coroner and the staff, and how the office has changed since the early days. We'll also learn about long overdue projects with which the coroner has been collaborating with the county archives and the soon to be completed county morgue. And we're very privileged today to have as our speaker Pamela L. Gay, who is the York County Coroner. Pam Gay has been a registered nurse for 39 years and has been York County's elected coroner since 2014. Her critical care nursing and forensic nursing background have been greatly beneficial to her in her role as coroner. Pam and her deputy coroners conduct forensic death investigations in York County and interact daily with the families of their decedents impacted by sudden and traumatic death. Pam has been married to her husband, Jeff, for 37 years, and they have 2 adult married children and 3 grandchildren. And Jonathan pointed out to me yesterday that Pam is in whole or partly responsible for getting he and his wife together. She encouraged him to ask his wife out for a first date. So we're very happy to have Pamela Gay. Thank you.
Pam, your mute is on, I believe.
Okay, wait a minute.
There you
Now,
are.
Can you hear me? You would think
Yes.
I do about 4 of these a day at times, believe me. And so you would think I would have it down by now, but apparently I still have problems with it. But yeah, the matchmaking goes back a long way. So it's kind of funny Jonathan mentioned that, but that is true. Long story, but anyway, some other time. So I am going to get right into what we do in the coroner's office. I understand what I have about 45 minutes. Is that right? And then if there's questions afterward, we'll entertain those if anybody wants to write them in on the chat or however you want to do it later. If you can have me share the screen, Nicole, I'll pull up my presentation here.
Sure, go ahead.
Okay. And I can't see what you all can see, so you have to tell me if you can see this. So
Did you have to hit the share screen at the bottom?
yeah, I do. You're right. Sorry.
That's all right.
All right. I'm so used to being in control here. So, all right. So now I have to pick which one. This one. Now, can everybody see that?
Yes.
Okay. I'm just thinking maybe we'll just go right into I think I can do the slideshow and do it manually. It'd be easier than view normal.
Yeah, if you go to slideshow and then from beginning.
From beginning, got it. There we go. Boy, am I getting rusty. I used to do a lot of in-person presentations, but everything's been Zoom over the last couple months, needless to say. So, and we really haven't done that many presentations. So thank you for this opportunity. So I want to talk briefly about the history of the coroner in general, how long it's been around in the country, and then we'll kind of narrow in on Pennsylvania and York in particular. Our office, believe it or not, has been around since 1749. We were among obviously the first row offices that were, excuse me, offices that were established, and I'll talk to you about how that was formed. It was actually a little different than a row office years ago, but we have been around for a very long time. This is a photo of our new facility. We are actually part of the prison now, and we are in an area where they used to house ICE detainees, believe it or not, and they don't get as many right now. And so for that reason, they're using that extra space to house us and to renovate at a fraction of the cost an area of the prison that we can use as our offices in our county morgue. That we moved in July of last year in the middle of the pandemic, which was interesting. If some of you are aware, I know you are, but the nursing home was sold along with the property, the annex property where we were. If you never had the chance to come see us there, you've lost it. It was quite an interesting place, pretty much needed a lot of work, very dilapidated and kind of dreary. The county did their best to keep it usable for many years, but it was getting to the point where it was just too costly. So that was sold along with the nursing home. And in that process, we had been scrambling, looking for space for quite a while, actually. If you remember, some of the folks at the annex moved to the new Pleasant Valley property, which was the former Lincoln General and Graham Packaging. Anyway, we were not able to utilize space there for various reasons I won't go into, but we had to find other space. And so, you know, I was at a director's meeting with Claire, the warden, and he mentioned about this space. He wanted me to come see it. We went and looked at it, and we felt very strongly right away that it was going to suit our purposes. So it all worked out. And for a fraction of the cost, for about 2.2 million till it's all said and done, the coroner's office and morgue will be finished. You know, the morgue will be finished in a few weeks, hopefully. And the county will be getting a very good facility, hopefully, with great technology for the future and a space for the future, that will last us hopefully at least a few decades. So we're very excited about that property. So I'm going to talk a little bit about the history of the coroner. And we do this talk sometimes in high school and colleges. And one of the things that some of the kids seem to remember is going back to the song in the Wizard of Oz, where the coroner had to declare death and sang about their role. We are not like it's pictured in the Wizard of Oz. It's a little different than that. However, it did begin long ago in medieval England. The coroner's role has gone back. There's been actually documentation that coroners existed as far back as the 11th century. So the word coroner actually came from the word crowner. And that meant that we were a crown official, you know, who held these powers. And we conducted these investigations to balance the power of the sheriffs at the time. And actually the coroner helped. If somebody died, often that land would go to the king. Thankfully, we don't deal in real estate anymore, but there are some coroners that still get a little more involved in the real estate side of things. We do not in our office, but yeah, that was one of the things that was their duties. And basically to hold an inquisition to investigate the cause of death. And that was the main goal, the main role, and the main job. In English-speaking countries, we were a government agency responsible for death investigations. And actually, we still are. We're a third-party government entity that comes in, and we sort of are a liaison between law enforcement and the people, if that makes sense, to make sure, hopefully, that everything's being done appropriately. In some ways, it helps, prevent, police from, any kind of rogue police work, which doesn't happen, thank goodness, in our county, or at the same time protects them in some way, so that they're following a standard protocol, that the coroner is involved, coroners are observing, overlooking, and they can report back and say it was done this way and there was no evidence, tainted or removed from the scene, if that makes sense. When the United States began, there was actually no provision for coroners in the Constitution, so each state had to figure it out on their own. Most of them followed what they were familiar with over in England. William Penn actually made the coroner a county officer in his frame of government. And so the freemen, I thought this was interesting because I actually just discovered this. The freemen of each county were actually permitted to elect 2 people, and then the governor chose one of those 2 people to be the coroner. So that's how it worked up until 1838, when it became wholly elected by the people. So the people chose, their coroner at that point, and the governor wasn't involved. The terms were 1 year at first, and then after 1790, it was 3 years until 1909, and then that's when it started becoming a 4-year term. And since 1909, it has always been a 4-year term. And there are no term limits on any row offices. Some people think there should be, and I certainly understand that. I will tell you, it took me about 4 years to learn the job well. So it's kind of, in some ways, if you have somebody that learns the job well in that 4 years, it's kind of a shame if you're replacing them every 4 years, because unless they're doing something they shouldn't be doing, because then they get a much better idea, and the whole process goes a lot easier when they've been in there a little while. I will not be in the role forever. This is my 3rd term, and I'm getting ready to run for my 3rd term, let's put it that way. I am heading close to 60 at this point, and want to spend more time with my grandchildren. So I'm not making any official announcement, but I am looking at eventually transitioning over to the younger kids, as I call them, in my office, and we will be, we've been grooming some of them to do that here shortly. So this is kind of a little snippet that I apologize, it's a little crooked, but I got it out of some information that Christy Depew in Archives was able to obtain for me. I guess it's a booklet called County Government and Archives in Pennsylvania, put out by the Pennsylvania Historical Museum Commission. Some of you may be familiar with this, published in 1947. And so basically it goes over all the duties of the coroner, which is kind of interesting because in many ways, those duties still exist. The one thing that I thought was a little interesting and different was it talks about a little bit, 2/3 of the way down, all fatal accidents in anthracite and bituminous coal mines must be investigated by the coroner. We don't actually have that clause in our job description anymore, mostly because we don't have those situations. But obviously, there could still be some coroners, any coroner would have to investigate a coal mine incident. I will just tell you that. But it was just interesting that was the focus back in 1947 when this was published. The other thing that I thought was interesting, it says basically when a death occurs more than 10 miles from the coroner's office, or when the coroner is for any reason able to be present, a justice of the peace may hold an inquest. That does not go on to this day, so I'm not really sure when that law was eradicated, but it doesn't exist. But it's just kind of interesting to read some of the older stuff. We actually have an old handbook that we're going to put in a shadow box eventually that was handed out to deputies probably 40 years ago, that has a lot of antiquated things in it, but very interesting to see how they did things back then. According to that same booklet, the coroner used to have to post a bond that was 1/4 that required by the sheriff. I have no idea how much that was because I didn't have the whole booklet, but it'll be interesting to see that. But apparently to hold the role, you had to actually post a bond. And then the annual salary ranges were, as it says there, anywhere from $1,500 a year in 5th-class counties up to $3,000 in a 3rd-class county. We are a 3rd-class county, but I will tell you that the salary is much more than $3,000 a year, thank goodness. Currently, and I always say this publicly because people ask, it's somewhere, I think it's 87, it's close to 88. It will go a little higher every 4 years. It does go higher. It's required for all the row officers to have a certain salary every 4 years. That's how it works. The first York County coroner is listed there, Nicholas Ryland, elected by people and appointed by the governor in 1749. And I have a long list of all the coroners that Christy has obtained and given to us, and we're going to use that eventually when we open up a kind of a historical section in our office. We, up until for a while there, it was the average citizen could become coroner. Then it seemed like they were only electing doctors, physicians, from 1808 until 1884, which is a pretty long time to only have physicians as coroners. And then there were no other physicians until 1958. The 1958 term and the 1962 term were both held by Dr. Thomas Hart, which we have a clinic named after him to this day over at York Hospital. And there's been no physicians that have held the office since then in York County. Lancaster still requires, well, I will say their Republican Party requires that it be a physician, but the actual, I don't believe the county code actually requires that. So it's kind of interesting how some counties, most counties do not actually require a physician anymore. And it really does not take a physician to tell that somebody's deceased. I will say that generally it would be helpful to have medical background, although that's not really required either. I personally think medical background helps because especially when you're trying to figure out a cause of death. So we always thought this was kind of interesting. We have an old program that we used to enter all the causes of death into, a DOS program, believe it or not. And one of my assistants actually pulled up some of these old causes of death. I'm not going to read through them all, but you can see how some of them are really kind of interesting the way they're worded. And this is public information basically. And this is some of the things we've been working with the archives to eventually allow the public to have access to. So the cause and manner is public information. But, you know, some of these, like, you know, accidentally falling into the lime kiln of Adam Herman and being overcome by evil gas. And this one definitely, I was curious, 1868, came to his death by being thrown into the privy of George Reaver by L. Jensen. It doesn't really tell you. I think if we did a little more research, we could find out, but I'm curious as to whether that was an accident or a homicide. Quite intriguing. We see a lot that say visitation from God, which is kind of interesting. A lot of them say bathing, where we think it actually means swimming, and so on. Of course, that very, very lengthy one at the bottom, which would not fit very well on today's death certificates, but was obviously a murder of some sort. Sounds pretty vicious. You know, we think we have some vicious crimes nowadays, and I look back here and I see that, and I think, wow, there were some pretty vicious things that were going on even back in the 1880s. Pretty bad. But anyway, just some really interesting, intriguing things that eventually we're very excited about. The public's going to be able to have access to some of this. So, and I'll explain more in a few minutes. So I want to just talk briefly about what the coroner is, and then we're going to talk about our particular office in York County. So a lot of people think that the coroner is a medical examiner or a pathologist or a forensic pathologist. And while a coroner can be a medical examiner, most of the time they're not. And when they're a coroner, they're actually in the role of coroner and not really medical examiner. It's complicated. But a medical examiner can have a practice with other medical examiners and do autopsies for coroners. And actually, we work with 5 medical examiners right now who do that. They're forensic pathologists, I should say. They have the ability to be a medical examiner, but they're not. They band together and form a forensic pathology team, and they do autopsies for the coroner. But they could each go off to some county on their own, a big county usually, and become a medical examiner if they wanted to be, because they have that board certification in forensic pathology. A pathologist is just one step below a forensic pathologist. They've been trained and board certified in pathology, in other words, the things that can cause death, but they haven't gone that extra year or more and trained in crime, how law and crime kind of intersect with death. So there are coroner's offices that utilize pathologists. There's certainly nothing wrong with that. Sometimes in court, though, they want more of somebody that's credentialed in forensic pathology. So in York County, we utilize 5 forensic pathologists to do our autopsies and to testify in our homicide cases and car crash cases and so on. So the coroner cannot do an autopsy. All right, I want to be really clear about that, unless they are assisting the forensic pathologist who's doing that autopsy, or the pathologist. And so I know there's some shows on TV that show coroners doing autopsies, but we are not by law the main one who does the autopsy. It's actually a forensic pathologist or a pathologist. And in our case, we don't go up very often because it's 2 hours away, kind of a bit of a hardship, takes us out of the field. But we do go up for training at times to view some of our autopsies. And we have a very close working relationship with our forensic pathologists. We're on the phone with them every day, a couple times a day, discussing our cases and so on. Medical examiner systems have been around since the late 1800s, early 1900s. You see them in bigger cities. So in Pennsylvania, you're going to see them in Philadelphia and Pittsburgh. So that's where you see medical examiners. In the rest of Pennsylvania, you see coroners. We still tend to be in the less urban and rural areas. It's just less expensive for a county to pay a coroner versus paying a medical examiner, basically, which would be more of a six-figure income. You have to pay for their staff, which usually their deaner, who's their assistant, as well as their backup, which is another forensic pathologist usually. So, you know, it would be very costly to hire two forensic pathologists, all their assistants, and things like that. So it's just a lot less expensive, because I get that asked a lot. Why do we go up to Allentown? Well, that's the main reason. It's just too costly at this point. It's, you know, I have enough trouble getting my budget through. It would be very costly and difficult for me to get through to house a forensic pathologist, the backup, the deaners. I would love us to be able to, and we'll talk more about what we did with this morgue to prepare for that someday, maybe. The other thing I would point out is there's only 400 practicing forensic pathologists in the entire country, which makes it very difficult. It's not a field that people are going into. And so for that reason, many of them group together, such as the 5 that we go to up in Allentown, because, and then they take on multiple counties. They service multiple counties. And that's what a lot of coroners do. They go to a particular forensic pathologist group in their area. Coroners do not need any formal education beyond high school. I think I already said that, which is always shocking to people. However, I will say it will be a difficult process if you don't have at least some medical or law enforcement background. And most people in my office have some medical background, and one of them has law enforcement. And they will tell you that the medical background, if you have it, the law enforcement comes much easier than if you're law enforcement and don't have the medical background and then have to learn the medical background on the job. So we're generally looking for people when we hire. We handpick, and we can pick whoever we want. And we generally only hire somebody with some sort of medical background. If they have law enforcement too, that's wonderful. Or in my case, the one that does have law enforcement is also a funeral director. So that comes in handy because he's had all the anatomy and physiology and so on. We provide death investigation coverage to York County, 449,000 residents now estimated, 7 days a week, 24 hours a day. Our jurisdiction, as it says there, covers 910 square miles. We can be on a call in Dillsburg and have to get the next call all the way down to Delta. We don't assign by geographic region. We just, whoever's on that day, they scatter everywhere. And there's a couple of us on at a time. Sometimes if it's really crazy, I'll be backup, and then we have to sometimes get more backup. And we can have 4 or as many as 5 of us out at once sometimes. It's rare, but I would say 3 is not unusual to have 3 of us out at once. So jurisdiction, I already talked about. When on a case, it's important to understand this. The deputy coroners have the same role and responsibility as me. So they cover most of the field scenes. As I said, I'm backup, or if we get busy and have a multiple person fatality, I'll go out and help on those. When I first started, I shadowed for about 2 years, every single case I could to learn about it. I went out with all the deputies and learned and worked the cases with them. Right now, the case management side of it has gone so huge that there has to be somebody in the office that's a coroner. At all times, pretty much. We have had some rare instances where we've all been out and we haven't been able to be in the office. And then we're doing a lot by phone, as far as with our secretaries, with approving cremations. But even that is hard sometimes when we're all out, because sometimes when we're all out at a very remote scene, and we have very poor coverage, cell service as well as radio. So that can become a little difficult. We basically are there with other people. We try to find out who has the best signal, and we use them to be our gopher as far as explaining things or helping make calls or communicating with our staff. But that doesn't happen very often, thank goodness. The office is separate from the morgue. We share a morgue at York Hospital right now that has 9 spots for a county of 449,000. Definitely, we have outgrown it long ago. Okay. Coroner Bloss was talking about how we outgrew it 16 years ago. When I first became coroner in 2014, I realized quickly that this was just not going to fly for very long and that we needed to figure out something. So we met with York Hospital, who was already more than willing to tell us we'll be happy if you guys get your own space. We're done. Because we were taking up a lot of their space, and they've been graciously letting us use that for decades, with no fee. But it's just it's just gotten out of hand because we are on overflow most days, at capacity or on overflow most days, and COVID has just escalated it drastically. So it's not unusual for us to have anywhere from 16 to 20 decedents in there at times in a 9-person morgue. Yep. How do we do that? We actually have to use a room right next to the morgue and turn the temperature down and house bodies in there. Yes, I'm sorry, but that's what we have to do. I don't mean to be graphic. So we have desperately needed this space for many years, but it's really escalated, I would say, in the last 3 years, and especially in the last year with COVID. You know, what's happening is our overdose cases are taking up space that they could be using for the COVID cases. And so we're constantly trying to get our overdose cases out of there after autopsy. And it becomes quite a dance between us, York Hospital, the funeral homes, and so on. We'll be glad for our own space here in a few months. So that's the makeup of our office right now. I'm not gonna go through every single one of those, but as you can see, when I talked about the medical background, you can see that most of us do have that. My new administrative assistant is actually a 20+ year Navy veteran also. He's amazing, Daryl. And then Vivian, who's been there for years and since Barry days, understands the makeup of the office and all the history, and she's a very valuable asset that we depend on. And she works part-time now, but she definitely she still helps us a lot. She coordinates the volunteer program, which we have a volunteer program that reaches out to the families, and she's really great with that. And then right now we are actually working with less people than we've had in a long time, and we're feeling the strain. We're getting ready to make a couple new hires, but it's just been exhausting, needless to say. The part-time deputies all have other jobs, and that may sound like a lot of part-time deputies, but if you notice, there's just me, a full-time chief, and 3 other full-timers. The county prefers to hire part-time deputy coroners at this point as a cost-effective measure. Basically, those part-time deputies are on call at $3 to $5 an hour. And then when they get called out, they get paid hourly. So it's not the kind of job that you want to depend on for your main income or your second primary income even. But there's times where they're very, very busy. Most of them work other jobs. One of them's retired and then works with us. But definitely they are very committed and work long hours. We can put in for an open slot when somebody's sick or something, and within minutes, we have it filled. They're just an amazing group of folks, and I couldn't be more proud of them. So I want to talk a little bit about the death investigation process. This is what we do, basically, the main thing that we do. So we're going to try and figure out the cause of death, as I talked about earlier. We're looking for the disease or injury that's responsible for the lethal sequence of events. And then we're going to try and figure out the manner. And that can get a little tricky. Sometimes we come up with the cause right away pretty quickly, but the manner, we might make it all pending until we kind of do some other things to figure out or rule out certain things. So obviously, the manner of death is those 5 categories that you're probably pretty familiar with if you watch any shows on television, crime shows. But natural, we do some natural deaths. We go out to some, we don't go out to all. Obviously, doctors certify most natural deaths in the county. But I'll explain why we go to some of them. Homicides, obviously, every homicide we are required to be at. Every suicide we're required to be at. Every accidental death we're required to be at. And then if it's the one that's the most difficult is an undetermined. And we do have a handful of those a year. I think we had 7 this last year that are undetermined. And it's just really difficult because we want to be able to give the family answers, and sometimes we can't. And these are the types of deaths that we investigate. I'm not going to go into all those, but they're basically subsets of those categories that I just told you about. One of the things that a lot of people don't realize is if somebody's unidentified and they die, that becomes a coroner's case. And then we're working to try and figure out who that person is. And we do get those on rare occasion. We actually had one a couple years ago that I'd like to refer to, that we found the body along the Susquehanna, right along the bank of the river. If the body's on dry ground, it's the coroner in York County. And if they're still in the water, it would be whichever county they might still be in the water. So whether that be Dauphin, or sometimes it could be, well, obviously Lancaster. But we get asked that a lot. So it's kind of strange. It has to do with the White Rose and the Red Rose city or counties. And it has to do with where the lines are. And the lines happen to be right at the shore. And we had a case where the person had something we couldn't figure out. They'd been dead for months. We couldn't figure out who they were. No identifying, most people, believe it or not, don't die with their ID on for some strange reason. But we had to try and figure out all kinds of things. And turns out that the person, we had our dentist look at their jaw, which we often do, and look at the teeth. And he was able to figure out that there was something unusual about one of the caps, something to do with something that was only done in Japan, believe it or not. So we were able to put in a request to see if there were any missing persons in that area between us and PSP. The PSP was able to track it down, Pennsylvania State Police. And they found that there was a person that had been missing for some time who had upstate, had jumped in the Susquehanna and completed suicide, they felt. It had been partially witnessed by some individuals. And they never were able to find the body. But as it turns out, this man was that individual, and we were able to send his remains back to his family in Japan. So it's just, it's rewarding. It's difficult because we're trying to figure out, an identity, but at the same time, it's rewarding when it works out and we can reunite the family, even in death, to know that their loved one, so they have some resolution as to what happened. And then the natural deaths that we go to, that I told you I was going to reference again, these are deaths in which the doctor can't or won't sign. We have a lot of people in the southern part of the county that have a Maryland doctor, and unless they're duly licensed in Pennsylvania, the coroner has to go to those cases, which is kind of frustrating for us sometimes, because it's not really a coroner case per se as far as trauma. A lot of times it's just a very natural death, but because the patient doesn't have a doctor that's duly licensed, we have to, by law, go to those scenes and sign off on those deaths. And if the doctor won't sign, we do talk to them about that a little bit, because they really need to sign off on their patients. They know their patients better than us. And we usually get back to them right away and explain to them why they should be signing. And then we kind of help them come up with the cause of death sometimes. You would think, in medical school that they get that training, but they only get about a 45-minute session on how to write a death certificate. So we are a lot of times educating them on how to do that. And so the death investigation process involves all these different steps here. We're looking at the scene, we're collecting evidence. Sometimes we don't collect a lot of evidence. There's a crime team that does that for the county, as well as some of the police jurisdictions. We do interview witnesses and family members, sometimes with police, sometimes separately. We collaborate with law enforcement. We conduct our own investigation alongside of law enforcement, but yet we work together also, if that makes sense. We do our own forensic photography, as well as police do their own forensic photography. And then sometimes that's helpful because sometimes we pick up on something they don't, and vice versa. We are very careful at documenting. We have a whole case management system. We remotely can document. We have all that capability with laptops. And we used to have jetpacks. Now we just use a hotspot on our phone if we have good service. We order autopsies, and if they're not going to go for an autopsy, we will do our own toxicologies. We started doing those years ago on our own cases, rather than having the hospital do them and having to transport them to the hospital. Now we can do the toxicology right on scene, and then we can release them to the funeral home, and saves the taxpayers some money. We also have to arrange for transport of the decedent if the family can't decide on a funeral home, or if we haven't been able to reach family yet. For instance, a traffic crash, we haven't been able to go to the house to make a notification. A lot of times they're going to be going for autopsy if they were not the at-fault driver. So we're going to send them to the morgue anyway, and then we'll make that notification, and then the family will choose a funeral home after that. We also arrange for transport up to autopsy. We do not do our own transport. We contract with Spring Grove. That contract goes up every 2 years at this point, and Spring Grove has just re-awarded it. So Spring Grove Ambulance does our transporting right now. We also obtain medical records in a lot of our cases. It's not unusual for us to be going through hundreds and hundreds of medical records, pages of medical records on a decedent, especially if we're not quite sure how they died. It appears to be natural, but we have to learn more about their medical history. And we want to we have a lot of nurses on staff, so we really want to know what they were suffering from, what does the scene look like, and how does that kind of go with it to match up with what some of their things are that they're suffering from. And sometimes it's an educated guess, I will be honest, but we do not autopsy a lot of older individuals who appear to have died of natural causes. But there's certain criteria for autopsy that has to be met because obviously that's a taxpayer expense also, and we want to try and be cognizant of our taxpayer money. And then sometimes we obviously we issue the death certificate, and then sometimes we have to testify in court, which is not our favorite part, but we do have to do that sometimes in some of our cases, or give a deposition. Some additional duties that a lot of people don't think about that we have to do is actually in our cases, we're usually the ones that notify the next of kin of the death. Police go with us and they assist us, and we don't carry weapons, but we are not armed, but police are. Obviously, if there would ever be any kind of violent altercation upon us telling somebody of their death, then the police can intervene. But we're not really so worried for our own safety. Sometimes we worry about people trying to end their life when they're being told about another loved one dying. So we want to make sure police are with us at those notifications. On rare occasions, if we don't feel there's going to be any real need for it, we will do it ourselves. But most of the time we have police with us, but we do the actual notification. We also have to do a lot of death notification via phone because of long distance. We can't send somebody out many miles away or many states away. We try to involve their local police jurisdiction, but sometimes that just takes hours and hours and hours. And sometimes those police are very involved. There's that law enforcement in other things. And they don't like to do it either. So it's just sometimes quicker, unfortunately, to do it by phone. We spend a lot of time looking for next of kin. We are constantly trying to find next of kin because people die with very limited information. They have, they're sitting at the morgue. We have to get them out of the morgue because the morgue's so crowded, as you know. And so we spend a lot of time on various search engines. We have a genealogist that works with us, actually, who's amazing. And we eventually we find next of kin almost all the time. On rare occasions, we don't, I should say. But eventually, even those individuals will come forward quite frequently because they'll find it in the paper weeks later. They'll see it online or something. But if we can't find next of kin, or even if we do and they want nothing to do with the decedent for some reason, we can't force them. And so we cremate at county cost. We have an agreement with a few funeral homes in the area, and then they hold those cremains because we don't have space for it right now. And then the family can still come get the cremains even if they haven't paid for that cremation, but they cannot get the death certificate by Pennsylvania law. So only if they're going to file an estate, the concern is, and they would have had the money to pay for the cremation. So that's one of the things that the funeral home has the right to do, is not give them the death certificate. They can always eventually pay for it online, but they have to prove that they're next of kin. We spend a lot of time explaining autopsy and toxicology findings to the family. That is very hard on families. It's almost like the day that we did the death notification for some of them. It's like reliving it all again many weeks later. So that's always a really difficult time. And our volunteers are working closely with the families during those periods of time. We collect a lot of data and submit it to a lot of different agencies. Even the Department of Justice uses a lot of our data. The Department of Health uses a lot of our data. And then we do a lot of educating the community with our data. I'm going to talk about our annual report here in a minute. We do a lot of press releases on all our public deaths. So our car crashes, our suicides that are in public places, and our homicides. So I have to do one here shortly when I'm done with this presentation. We put those out on Twitter, YCO Coroner, if any of you follow, at YCO Coroner on Twitter. And that's where we update everybody at once. When I first started, we used to had a line where the media called in. It was kind of ridiculous. We had to redo stuff all the time. It was like an answering machine, but we early on, I just like, I'm going to learn how to do this Twitter thing. And so we put it all out on Twitter. All the media gets it at once. And at the bottom of each press release, it says, that's all I'm going to release. Don't ask me any questions. And so they were getting a lot better about not calling and bugging me about the cases. So we learned early on that it could jeopardize the case, especially if it's an ongoing criminal investigation. And so we do not do we do not do interviews on ongoing cases. So they've gotten the message. We serve on a lot of committees and task forces, many, which are mentioned in our annual report. We do a lot of disaster and multiple fatality planning, which we did some of that obviously with all that was going on over the last few months, or last year actually, with the pandemic. And it's always been in the back of my head, and I knew that we had to update our plan, but I tell you, the pandemic put us into the forefront, and we knew we had to update it in a hurry. So we have wonderful emergency management folks at the county to help me get that in place. We were looking at refrigerated morgue space for a while during the earlier days of the pandemic, but mostly because our overdose cases had skyrocketed so much that I just felt the pressure. I felt terrible about taking up so much space at York Hospital. Excuse me. And I knew that we had to, we were just really constrained at the time. But we actually worked some things out, and we, at this point, we only have a couple more weeks, and they'll be done with our morgue, and we're going to make it without having to get that refrigerated morgue space. But there was a time where we actually contemplated it, and we're trying to be very sensitive to the fact that we are taking up, space at the hospital, and they really need that space right now with the surge that was going on in late November, at least until the last few weeks. Now it seems to have slowed down a little bit, which we're very thankful for, of the COVID cases. We track communicable diseases in the county, like COVID. We do not go to every COVID death. Actually, the doctors certify most of those because they occur in hospitals and facilities, nursing homes, for instance. However, there's some COVID deaths that occur in the community, and those are our cases most of the time. We've had a few of those, and then we've had some COVID cases where there have been hip fractures and head bleeds from falls and so on, and those are our cases too. So we have been impacted in many ways, which I'll explain here in a minute, by COVID indirectly, and we'll talk about that shortly. And then we are constantly educating healthcare personnel, physicians, funeral homes, in regards to what makes up a coroner's case. Part of why we approve the cremations is the body of evidence. The body is evidence and is gone after cremation, needless to say. And so it's on us to make sure that that cremation is appropriate for the type of death that's being itemized, basically. And as we look at it, sometimes we see things that are red flags to us that, we probably need to check this out a little more. And so we look in the medical record and we're able to see that that person actually had a fall that caused a hip fracture, and that basically sped up their death. And that's even though they might have had pre-existing conditions. And the doctor mentions the fall sometimes on the death certificate, and they try to sign it off as a natural death when in reality it's an accidental death. So we have to do a lot of re-educating and catching and screening those cases, which is required by the CDC and the Department of Health. So our annual report came out last weekend, actually a week ago, and you can get it on our Twitter page. You can actually download it or view it if you just don't want to download it. You don't have to. But you can see how our cases have increased so much over last year, and I get a lot of questions about that. Overall cases have gone up almost 2,000, they're listed over last year. And I'm talking about over 2019 is what I meant to say. Our overall death investigations have increased, but pretty much the pace that they tend to increase, anywhere from 60 to 75 a year more than the year before. That's kind of typical because we're a growing, aging community. That's not unusual. Our overall referrals have really drastically increased, almost 4 times what they were. And that has to do with we're requesting all the facilities to call so we can screen for COVID and so we can screen for fall deaths. And so because they're calling, then, if that decedent didn't have trauma or didn't have, or had COVID only and doesn't involve a coroner's case, COVID and some other comorbidities that are medical conditions, basically, then we're going to let the doctor just sign off on that. But by us screening, we've been able to catch some fall cases that should have been ours from the beginning and so on. So that's one of the reasons why referrals have gone up so much, because more and more of the facilities are really calling and letting us know when there's been a death, which is what we're asking them to do. I can't legislate it. I can't mandate it, but a lot of coroners want those deaths reported. And then all COVID-19 deaths right now, because it's a communicable disease, they all have to be reported to the coroner by Pennsylvania statute. And that was a little bit of an issue with the Department of Health back at the start. Some of you may have seen that start of the pandemic. And I was pretty vocal about how we just needed transparency because people trust the coroner. People don't necessarily trust the state as much as they do the coroner. And we were asking them to allow us to have access to the deaths in our county so that we could really verify that those numbers were legit. And honestly, we feel that the numbers are accurate. And now that we have access to that information, they did give it to us eventually. And we check that every couple days. And we want to make sure that that matches up, and it does appear to. And so those are really valid COVID cases. And we want people to understand that the numbers are real. And we're inching towards 700. We might even be at that point, by this week. 700 or so coroner deaths in the last year. So since the pandemic began. But by the end of 2020, we had 419 coroner deaths. COVID deaths that were not coroner cases. I got to correct that. COVID deaths that were not coroner cases, 19 of them were coroner cases out of that 419. But yeah, definitely the end of November, December, and January, we noticed a trend upward. We do believe it was related to holiday gatherings. We were having as many as 8 to 12 deaths a day from COVID-19. Yes, mostly in the older population, but we are seeing people in their even 30s, 50s, 60s dying of COVID-19. Very, very tragic. And we have been very adamant from the beginning about following the CDC guidelines. So that report can be downloaded. It's got a lot of information, itemized information that some of you might find intriguing. But if you have any questions, you can certainly give me a call or shoot me an email about that. And I can give you my email when I'm done here. So some of the highlights from that report were our drug overdoses are now at 197. They're going to likely top 200 until they all come in. We have a couple pendings that are out right now. Our home and play accidents have increased to 172 over 100. I think it was 140 some the year before. 130 of those 172 are actually fall deaths in the county, in York County, mostly among older adults, highly preventable deaths. So we do a lot of education on how to make your home safer, how to be more careful as you get older. But obviously we still are losing a lot of older folks to falls. And that's something that's really concerning. And we have a whole coalition that really goes out and educates when we're not in a pandemic. We're doing some of it online, virtually right now. Suicides have decreased for the second year in a row. So that is a bright spot, as hard as it is, we still lost 60 people, highly preventable death. Homicides have decreased, again, highly preventable, but they could have been worse, especially in this really stressful times that we're all in. And the traffic crash and pedestrian deaths are about the same, 40, a little bit higher than what they were the year before at 37. So those are some of the other findings in the report. So I get asked this all the time: how have you been impacted by COVID? If you're not really certifying all those COVID deaths, how does that impact you? Well, we have this increased caseload. We have these screenings that we're doing. We have a lot of planning for, you know, the drug overdose cases, as I was telling you, a lot of that mass fatality planning. Yes, it's not all at once, but sometimes it feels like that when you're having 8, 10 COVID deaths a day, and then you're having 20 to 22 overdose deaths a month. It does feel like like it's a mass fatality at times with the morgue space. Excuse me. It increases our cremation approvals, believe it or not. We had to, you know, obviously I go back here a minute to the cremations, 2,908 cremation approvals in 2020 and 2,447 in 2019. So our cremations are up significantly, a couple hundred there. And a lot of that has to do with the COVID deaths. You know, because of the biohazard and concern, there's been actually evidence that COVID can be transmitted after death. So the whole burial process is different. Some folks are choosing cremation, and for that reason, it can be backing up the funeral homes. The funeral homes were actually really backed up over December and January. So we were doing our best to work and approve those cremations long into the evening so that they could continue to process those decedents through their funeral homes. But that obviously takes time and energy on everybody's part. We also needed a lot more PPE. Thankfully, we had set some aside. When the state gets rid of some that's expired, we go and pick it up in Harrisburg sometimes, or we have a police agency that brings some down for us. And we were able to keep an ample supply, although we were very worried for a while about our N95 masks because they were pretty low. But we really didn't get much from the federal government at all. I'll just tell you that. That's all I'm going to say. But we had to take care of ourselves, and we did a pretty good job of it. The county helped us, you know, in whatever way we could. We all helped each other, and we helped the funeral homes wherever we could, because initially they didn't have hardly any PPE compared to us. So if we were all out of cases together, then we would try and share. So there's been obviously the overcrowding too. I'm going to try and wrap it up here so we can get some questions. We had staff members with COVID. We were quarantined with COVID. Some were juggling with their children, obviously schoolwork, in virtually doing more with less. And moving to the new office, we had a lot on us, like a lot of you did, that were working during the pandemic or trying to function during the pandemic. Even if you were home working, it's a strain. So we have an ongoing project that's going on at the archives right now. They're helping us digitize all the manual records of death investigations. Everything was handwritten until August of 2009. After that, it was all digital. So they really helped us a lot. We've got most of that digitized. It's almost done. Some of the information will be available to families, and some public information will also be available to the public. So currently, only the coroner's report is considered public information, or an autopsy report if the case is litigated or becomes a criminal case. Cause and manner for each case investigated will be public information. They'll be able to access it eventually. There'll be some sort of safeguard so that we'll know that you can't obtain this, only family can obtain this, that kind of thing. But Christy's helping us set all that up, and they're amazing over there. Oh, I made a typo there, but we already talked about some from the 1800s that have those causes of death. That will be very interesting, I think, to some of the historical folks that are really interested in that kind of information. All right, I'm going to open it up for questions. If I'm done sharing my screen, if you want to, do I stop share? Is that what I hit? I think.
Yes, good. You have a few questions.
Okay.
Get my light out of here. To start with, We have a question about the coroner's office, the coroner and public health. What role, if any, does the coroner play in advising county commissioners regarding like critical actions during a public health crisis?
Good question. We do not have a county Board of Health, as everybody knows. We have a city Board of Health. We do have a consultant for the county, Dr. Matt Howie, and he and I work together on a lot of things. So he is sort of my liaison to the commissioners. So he kind of lets them know when, there's things that concern me and so on. And I do the same. We also get the word out through various presentations and things that we do with the commissioners. But right now, yeah, the coroner is basically the public health component of the county to some extent. And actually, to get accredited, which we're going to try and do now that we have our morgue, to get nationally accredited, that's something that they look at. They want to see that you are out in the community doing that education, doing that public health information, dissemination, so that they determine whether or not to accredit you based on that. So,
okay, thank you. Next question. Here we go. These are on Facebook. Has there ever been anyone in the coroner's office who was Black or Hispanic? And is there anyone there now who's bilingual?
Okay, good question. There have been Hispanic volunteers, and we have Black volunteers right now. We do not have staff who are. I've been trying to get one of the volunteers to come on as staff, but she's not quite ready to do that, I think. Yeah, it's something that I would like to strive for because it's a row office. We can kind of hand choose who, we do hand pick who is. I really do not have applicants, unfortunately, from minority populations very much at all. For deputy coroner positions. And obviously there's certain medical criteria that we look for that we have set up in our job description, medical background and law enforcement background. And I really do not at this point, certainly if some applied, I would definitely consider them. But we just, other than the volunteers, we haven't had any minorities apply since I've been there, so.
This is a related question, Pam. What certification is needed to join your team?
So every coroner sets up their own criteria, and in our office, we're looking for people with nursing, EMS, law enforcement background are going to get probably higher priority, just because that training sets you up to be able to handle what we do. I have hired some people in the past that have only lasted a couple weeks because once they saw what we did, and honestly, you have to get used to having your sleep interrupted constantly. You have to be able to go out to all kinds of scenes and all kinds of weather, hoarding houses with lots of animal feces. I'm not trying to be graphic here, but I'm trying to explain. And very awful smells and drainage and all kinds of things that you have to succumb yourself to. It is not like you see on television, okay? And we always say, if only they would put it in smell-o-vision, it would really help, but they don't. And so I get a lot of people that see things on TV and think it's really glorious and glamorous like that, but really it's a lot of hard, physical, dirty work, along with all the administrative computer stuff, so.
Interesting. One more question. This is from Jonathan. He's asking about the coroner's records. How far back do they go? What are the restrictions to access them? And are they at your office or the county archives?
Okay, good question. So they're going to be at the county archives eventually. That's where we are sending them all. The current records that people can see cause and manner of death in any given year since I've been coroner, they can come in. We have a binder that has cause and manners of death on individuals. Anybody can come in and look at that information. I'm required by law to either have that in my physical space or at the prothonotary. And the prothonotary and I have an agreement, since I'm far from the prothonotary, for me to just have it there. Years ago, it was required to be at the prothonotary because the coroner's office and the prothonotary were all in the same building, basically, or close by. But because we moved out, we were basically among the only row office allowed to move out by county code. We are permitted to keep them in our office. So the cause and manners of death on our cases are at our office. However, eventually the public will have more access toward some of that information into the 1800s, as far back as the 1800s. I don't have an exact date for you, Jonathan, but I know that there's nothing past the 1800s as far as I know, other than what we find in books about who was coroner, how they were elected, that kind of thing. And then there was a period of time where there was some sort of damage downtown, and maybe some of you know about this better than I, but it destroyed files that were in the basement of the courthouse, and some of those files were coroner files. And so there are some records that for like a 20-year period I think it might have been even in the 1900s, where we were missing some records. But I have to get back to you on that. Christy was actually the one that told me about that. I didn't know that, so.
Well, thank you, Pam. I think that's all the questions.
There's something in the chat here.
Let's see, Lynn has actually put up a note with the county archives has records through 1958 and web.
And actually what she's doing right now is 1958 to 2017. So that's that project I was talking about. Yep. So it's going to be through 2017. We're soon ready to lift that restriction, open it up to the public, but we have a few things we got to work out first. So.
Okay. Well, we have another question here about cemeteries. In situations where a body is disinterred or moved to a different cemetery, does the current coroner need to be involved?
No.
No.
No, unless they're doing it themselves, maybe. I don't know. They should be involved in a funeral home, hopefully. Yeah, if the neighbors see somebody doing it themselves, they might want to give us a call. But generally, yeah, as long as they're involved in a funeral home, it's all legit. So we get asked too when people find urns like in a house that they just bought, you know. And actually we don't take possession of that, and they can do what they want with it, believe it or not. By law, they're not required to like send it somewhere. Most people don't feel comfortable just destroying it, so they usually talk to a funeral home about housing it. So
that makes sense. Well, thank you, Pam.
Thank you, everybody. I appreciate it. I'm sorry for the technical difficulties when I first started there, but appreciate the time. If anybody has any questions afterward, you think of it later, you can always email me, plgay@yorkcountypa.gov.
York County spelled out?
York County spelled out, yeah. Or you can go to the website, yorkcountypa.gov website, and you'll find us under row offices. So plgay@yorkcountypa.gov.
Great, thank you.
Thank you. Take care. Have a good rest of your day.
Yeah, I wish to thank the coroner for her excellent presentation. Thank you very much. And I guess with that will adjourn the meeting. However, board members who are around, I want you to stick around for a minute or two to see